This patient was referred to me for endodontic treatment of tooth number 25. According to the patient, all of these crowns are about 2 years old. Okay, and then recently she started to have pain associated with tooth number 25. As you can see, large periapical lucency. This tooth, when I saw the patient a couple of weeks ago, had Miller class 2 plus mobility. And we discussed options with the patient, trying to see if we can save the tooth versus extraction. The patient said no way she would extract the tooth. She wanted to try the root canal first. If root canal worked great, if not, then she said she would extract the tooth. So this patient needed to be sedated because of her dental anxiety, and she said her teeth were extremely sensitive. So even for the crowns, she was IV sedated. So today we went ahead and started and completed the endodontic treatment in one appointment. This was a porcelain crown, and I said Miller class 2 mobility, 2 plus mobility. By the way, so that's the tooth here. You can see the labial swelling also. There was a labial swelling also associated with the tooth. This is a mid-obturation PA that we took just to make sure that my MTA went all the way to my working length. I just wanted to make sure. But yeah, so this is mid-obturation, just to make sure that my MTA was delivered to the working length. And here's the final post-op x-ray. As you can see, everything went beautifully. Look at that bifurcation in the apical area of the canal of tooth number 25. We were able to clean this bifurcation, not only clean it three-dimensionally using full-strength sodium hypochlorite, 6% sodium hypochlorite activation, sonic and ultrasonic, but we were also able to three-dimensionally obturate it using MTA. And I use white MTA, by the way. White MTA for the anterior teeth. It doesn't stain. And as you can see, look at that beautiful bifurcation in the apical few millimeters of the canal there. MTA, and then the rest of the canal obturated with gutta percha sealer. We temporized the tooth and referred the patient back to her dentist. I told the patient, don't get a new crown yet. Come back and see me in 6 months. In 6 months, we're hoping that this periapical lucency has gotten smaller, which means the tooth is fine. Hopefully the tooth will also firm up as the body regrows and regenerates bone. We'll see.